Good afternoon. Welcome to the white coat ceremony. My name is John Lazar. I am the program director for the Advanced Practice Registered Nursing Program at the UCLA School of Nursing. I'd like to welcome everybody, all the students, faculty, guests, friends who are here today. This is a very special day today because in the past 2 years we had this ceremony virtual, and that's always different as the personal ceremony, so we are very lucky that we were able to go back to the regular way as we did before. We will be recording the event today, and we will share with the people who are not able to come the ceremony today, and they will be able to watch. I wanted to say a little bit about the white coat ceremony, why we're really having the white coat ceremony. Probably maybe a few people wondering, what is this white coat ceremony? The white coat ceremony is held in nursing and medical schools. And this is a transition for the students. Usually they're having this ceremony before they go to clinical rotations. So basically making the milestones. After all the theory classes, all the preparation, nursing schools, APRN students, after the bedside nursing, they flowing into the clinical rotations. And they approaching the whole care differently, and they provide a different level of care. So this is a very important milestone for these students. Before we progressing forward, I want to thank you for everybody, for all the help, and everybody who made this day possible. Thank you so much for everybody. I'd like to thank you, the faculty, for all you guys do and support our students. So our APRN students will be the best in the country and in the whole world. Thank you for the staff and the supporting people. They did a tremendous job with the preparation today. And thank you, family. If you like to, just go ahead. That's part of the game. I don't want to start, but you can start if you wish. And I like to thank you for the family and friends. You guys really supporting our students as they making the transition from bedside nursing to patient care at the different level as nurse practitioners and clinical nurse specialists. I also want to thank you, UCLA Health and Cedars-Sinai Medical Center, for the financial support for this event. I'd like to welcome you, Dr. Karen Grimley, who representing UCLA Health. And I'd like to thank you, Dr. Linda Kim, who is an alumna of the UCLA School of Nursing and representing Cedars. We are grateful to you for your support. And finally, thank you, students, for your commitment to learning and to nursing. And now, before we progressing to our keynote speaker, I'd like to say a few words. Introduction to our dean. It's my great honor to introduce our dean, Dr. Lin Zahn, who will bring the remark and the introduction of the keynote speaker. Dr. Zahn is the 8th dean of the UCLA School of Nursing. She joined UCLA August 1st, and before she came to UCLA, she was the dean and the chief nursing administrator at the University of Memphis, Löwenberg College of Nursing, for over 10 years. She also was the chief academic officer for the different campuses, University of Memphis operating in Memphis and Jackson, Tennessee. Dean Zahn is an expert on health equity for the vulnerable with additional scholarly interest on developing better measures for health-related behaviors and higher education diversity and workforce development. She also serves on the editorial boards of the Journal of Gerontological Nursing and the Journal of Aging and geriatric medicine. She was one of the recipients of the visionaries of the Geriatric Nursing, the Legacy for the Future Award in 2020 from the Journal of Geriatric Nursing. Dean Zahn is a fellow in the American Academy of Nursing, and since 2001, she served on the Academy's expert panels of aging, global health, and the Diversity, Equity, and Inclusion Committee. She also board treasurer for the American Association of Colleges of Nursing. Please join me welcoming our Dean, Dr. Lynn Zahn.
Well, thank you, Dr. John Lazar. Distinguished guests, faculty, staff, APRN students, and the family and the friends of APRN class. And I really thank you for coming to this very special event, which is a white coat ceremony. Really, with my own curiosity, I ask, where did the white coat ceremony come from? Why so? Here is this story. In 1989, LA Times, very first time in the nation, published a story called White Coat. What happened? A professor at the University of Chicago Medical School went to the dean of the students, complaining about the first-year medical students. When they were with patients, they were wearing shorts and baseball caps. So the professor said, that's not a professional. So the dean of the students at the medical school and mandate a professional look of medical students. So they created a small event at the very beginning, and the medical students also invite their parents, because the parents pay money, right, for the students. So all the medical students were told, wearing their white coat. Each one gave their white coat and said, we expect you look like a professional. We also expect you behave like a professional. So that was the story. After 4 years, in 1993, a professor and a pediatric neurologist, Arnold Gold, with his own foundation, and talked to the dean, Linda Lewis, at the university and Columbia University and the College of Physicians and Surgeons. And he said, I pay the money. Then you hold the formal white coat ceremony. Well, that's what happened in the medical school. And in 2010, the Institute of Medicine and issued the landmark document called The Future of Nursing, which made several recommendations. And one, about 80% of nurses should have a bachelor's degree, and also we needed to double number of the nurses have a doctorate degree. So finish your master, you still have a 1 degree to go. And nurses is not a supporter of the physician. Nurses are the partner of physicians. So with that, actually in 2014, Arnold Gold Foundation reached to the American Association College of Nursing. This is what his proposal. Since nurses should be the partner of physicians, nurses should have a white coat ceremony. I pay the money. And so that foundation gave the money for the initial 2014, and the nursing school want to hold a white coat ceremony. Each school gave $5,000 to do so. During that time, I found 2 very interesting articles about white coat. Patients, and more likely than healthcare providers, like the healthcare providers to wear a white coat because the patient is thinking you have knowledge, you have skills, and you can address the healthcare issues. They don't know how. And the same article also mentioned about patients actually share. When we see the doctors wear the white coat, blood pressure went up. And so because they get nervous. So the issue is not a white coat. It is how we interact with the patient. So with that very brief historical analysis, we can see white coat ceremony, and it has a symbolic meaning. That means when you wear the white coat, you have professional responsibilities to apply your knowledge and skill and keep lifelong learning because knowledge is evolving. So therefore, you practice precision nursing. Everybody heard about the precision medicine. Have you heard about the precision nursing? No. Nurses practice precision nursing from very beginning. From now on, you can mention about that. So in each clinical experience, when you wear a white coat, and I remind you as a nurse, when you actually position a paralyzed patient, your white coat might be wrinkled. And I remember when you feel heartbroken and get emotional. When I was a head trauma nurse, I was very young, and the patient was only 21 years old, died in front of my eyes. I was very emotional. I was crying. And the moment a surgeon told me, Lynn, quick, there is another patient, put your coat on. The moment I put my coat on, I stopped tearing, have to attend another patient. So this is sometimes the white coat when you're in the clinical settings. They are like your comforter or shield. And the patient is suffering, and you must keep going by providing the care to ease their suffering. It's not about you, it's about the patient. And your white coat also reminds you the purpose of the service. When you struggle with your own shortcomings, nobody is perfect. But when you wear a white coat, you know you need to keep learning. And also when you are frustrated, your white coat reminds you, still be kind, compassionate, as your patient needs you. So the white coat, after all, means place yourself into the service of others, the patients, their families, and communities. And always with kindness, always with knowledge and skills. And with 2H, I always talk about humility, that means keep learning, humble yourself, and humanity. I'm so glad we hold the white coat ceremony today. I have such honor to introduce our keynote speaker, and Mr. David Kosman. Mr. Kosman has been a successful trial lawyer for 42 years here in LA. Did you remember the poll in the United States, most trusted profession? And nursing is number one for 20 years. Do you know where is the lawyers? Nobody knows? I'm not going to talk about it. And Mr. Kosman spent countless hours pro bono without charge and helping to protect vulnerable animals. For example, he spent 10 years and over $7 million of his time just trying to get the Billy. Do you know who is the Billy? Billy is a lone elephant, baby elephant. And I want to take that elephant out of LA zoos because we keep them there think about what their environment. Now we talk about social determinants of health. Is that environment how important? That fight continues. In November 2020, Mr. Kosman retired from law practice, and he created a company called EcoFlix, the first nonprofit streaming video service dedicated to saving animals and the planet. At the same time, he managed his own very busy time and to give back to the people as well. He taught for free, no schools. So Mr. Kosman was elected to the president of a prestige legal organization, and he used that platform and his leadership to create and start a training program called Civility Matters. To this day, the Civility Matter program has taught nationwide to the lawyers that emphasize the importance of being civil and to each other, and also to the client and to the many judges, and that help dispense justice in this country. About decades ago, and Mr. Kosman convinced his brother and sisters to create the Muriel Kosman and Humanism and Cash Award to honor their mother here at UCLA. When she died, his mother was the nurse and also professor in nursing. This Cash Award is bestowed each year at the annual Nurses' Day presentation, given to the nurse selected by the patients and staff as the most compassionate nurse of the year. They just had that ceremony presentation last week, right? So this year I met Ms. Kosman and his wife, Pam, who was the nurse, and she is here with us today. And I never forgot what he said to me. It takes a noble, special person to be a nurse. That is indeed Mr. Kosman. We thank you for your support for nurses and for the nursing profession. Please join me. Welcome, Mr. Kosman.
Thank you, Dean Zahn. You know, it's an honor and an opportunity that I had not expected to be able to address the graduating advanced practice registered nursing class. And it's wonderful because it's timely. In the last 2 years, nurses have all of a sudden become visible. People didn't see nurses until COVID. Nurses were there, they were doing their job, but people didn't pay attention until nurses literally became the tip of the spear fighting COVID worldwide. And then all of a sudden people understood the absolute dedication and courage and indeed heroism in the face of a disease at that time no one knew how to deal with it. Nurses died. Some wrote their wills before they went to work. And because of that, people were standing up in the streets all over the world and applauding for nurses. It's about time, because nurses have been doing amazing things for a long time, but we haven't really noticed until now. And I'm not here today to talk about the law or to talk about the science involved or the medical techniques or all of the things that were involved in your superb training. All of you are well qualified and about to do much more than you have in the past. And it's incredible that it is here that I have the opportunity to talk about something that I have learned over many years, and it's an often unspoken truism, particularly about nurses. Nurses are critical, we know that, But not many people know that nurses can practice magic. And I say that referring to the heart that nurses give to their patients and their families every day. They come into this environment and they're frightened. We're talking about a situation where you're part of a medical team and you are working with the doctors and you're working with all different kinds of disciplines and equipment, but you are the point of contact in most cases with the nurses, with the patients. And the families come in and they're important and they look at you because you're there. The doctors aren't there. They come and they go. Occasionally they can speak to them, but generally speaking, you're there. And they're desperate. They're fearful. They want answers. They are necessarily in a foreign world, a medical world that they know nothing about, and they're hanging on your every word. And so what you say matters to the family. It means a lot. And at the same time, the families go. They can't stay, but you stay, and the patients stay. And so there you are with a patient who's scared, probably doesn't understand their own condition, has no idea about the surroundings, the medical equipment. It's all foreign. Bells and beeping and sometimes sterile. If you get wheeled into an operatory and it's just all shiny metal and you don't see that on television. You don't know what to expect, and as a patient, you are frightened. And then there's the pain. Every step of being a patient is upsetting and often painful. You get stabbed with needles and then they don't hit the vein and they got to do it again and all kinds of things. And so as a practical matter, as a patient, you are sort of isolated. You feel alone. And the only part of that that is positive is your contact with the nurses. Because nurses can practice magic. And you say, how can that be? How can I make a difference, really? Well, let me share with you an apocryphal story that I think of all the time. I think of it in context primarily of animals, saving animals, but it applies to people. It's a story about a little boy on a beach at low tide, and he's walking down the beach picking up starfish and throwing them in the water. Excuse me. And an older man comes up to him and he says, "What are you doing, son?" And he looks back with a smile. He says, "I'm saving starfish." He says, "Look down the beach. There are millions of them. You can't make a difference." And with the wisdom of youth, he turned around, he picked up a starfish, ignored him completely, threw it in the water, and turned back again with a smile. And he said, "Made a difference to that one." And that's every day for nurses. You can make a difference. And you do. And so, yes, it's important to show technical proficiency and competence and confidence, because if you don't, your patients will feel that. But once you've accomplished the technical parts of the job, often the key to everything, being there at the lowest point in their lives, is kindness. Showing them that little bit of extra reassurance, looking them in the eye, saying to them, "How are you?" Maybe taking a second to talk to them and find out what they're afraid of, how you can help them. Because humanism is what they need the most. They know that the medical side of it is being addressed. You're there, the medical team is there. That's not what scares them. What scares them is they're isolated and alone. So, especially with your advanced training and practice, please don't lose sight of this important component, because it's not all about the technical side of it. And I would say this to you, I know this not as a nurse, and certainly not as a lawyer, but I learned it many times as a scared patient. I've had more surgeries than I'd like to count. As a son, my mother, who you heard was a nurse, had colon cancer surgery. My wife, who's a nurse, I guess no mistakes, she had brain surgery. And of course, as a parent, when your children have surgery, there is nothing more frightening. And so, if you are in those situations and you recognize what my mother recognized, which is the power of humanism in nursing. As you heard, she was a nursing professor. She used to rail about how the nursing profession had declined. This is a number of years ago. And she came to California and happened to have her colon cancer surgery here. And for the first time we had ever heard her say positive things about the progress or the state of nursing, she couldn't stop talking about how great the nursing was here at UCLA. And she passed away of unrelated causes, but in her honor, we created the award because UCLA nurses had done such an incredible job. To impress her, you had to do something pretty good. So, yes, I think that it's important that you're highly trained and you all worked hard to get where you are, and you desperately deserve the recognition and a white coat, which we now know makes it even more important. But never forget that you hold the key. The magic is humanism. And I think if you do that, you will live up to the proud name of nursing. So I congratulate all of you, the UCLA Advanced Practice Registered Nursing Class of 2022.
Okay, so thank you so much, Mr. Kesterman, for your inspirational words. And I guess we're progressing to the next item now. I'd like to introduce Shionte Jones from our Family Nurse Practitioner program, who will represent the first year APRN class here today, and she has a few words to share with you. Okay.
First, I'd like to thank all of the administration and faculty, and especially Dr. Lisa Flowers, the president of the ASTCP, who motivated me to share with my fellow classmates on our watch. It is not what the white coat means to me. It is what it means to us collectively. It is our opportunity to be in the presence of transitioning from one level to the next, not just in our credentials, but in our mindset. So I ask, what does it mean to us? Why are we here? What do we want to take with us? What steps are we willing to take to share our insight? Insight that will not only impact our families, friends, patients, and colleagues, but society. I am a woman from Southern Maryland whose grandparents are farmers, served in World War II, had their own waste and redistribution business, and they were married for 73 years. Not bad for Black folks back then, huh? My pronouns are still evolving. I identify as Black, and my tribal roots are still being discovered. I come from a family that worked hard. They instilled love and respect. They taught me how to speak up in the face of adversity and do it with grace. They were my community. And because of their constant motivation, that community expanded to the patients and families that I've served over the last 14 years. I know, good genes, right? Later, I realized that my passion for advocacy for oncology patients, helping people to actively be involved in their growth and healing process, people from across the nation and the world. Prior to the pandemic, chronic illnesses and mental health awareness were on the rise. But now we see a worsening climate at levels we couldn't imagine. Our care restricted to ER and ICU, forcing primary care to figure it out while nearly being eliminated. Lives have been lost and families have changed. Collectively, we need to come together. You know, like the Beatles said in 1969, come together right now over me. Okay, so I'm gonna stick to my day job, but one thing I know we can all agree to with that song, even in its bizarre lyrics, the history. It brings us insight to our state of mind and our willingness to come together right now. We must lead and embrace on our watch. On our watch, we must be agents of change through our voices and actions to support underserved and underrepresented communities. On our watch, we must educate ourselves first and others about social determinants of health and meet our patients where they are. Yes, this will require time, patience, and well thought out strategy to see the change and get to the root of why. How will we harness this? With the warrior energy that's in this room. It takes a village beyond this ceremony, beyond UCLA, and beyond either you being an employee or an employer. It's time to bring our personal experiences and professional evidence to the people. We can do this together on our watch. Thank you.
Okay, thank you so much, Beyonce, for your speech. And before we progressing forward, we'd like to take a moment to recognize one of our own, George Jacoby, who entered the acute care program last year. He passed away unexpectedly on November 30th, 2021. His passing is truly a loss for us as a school and for the profession of nursing. We wish to express our heartfelt condolences to his family, who are joining us today through a private Zoom link. Acute care lecturer Catherine Cronin will lead us in honoring his life.
Deep breath. I will ask for your forgiveness for my emotion. My colleague Stacy told me that when I get up here to help me hold it together, I should pinch my finger. So if you see me doing that, that's probably, I want you to know that's what's going on. Okay. And I'm Kat Cronin. I teach in the adult acute GERO program for nurse practitioners. And I'm happy to stand up here and speak about George today. I'm honored to. Today's a time for celebration and hope, pride, tradition, and excitement. And the faculty here at the School of Nursing want to take a moment to honor George, who is no longer with us, but who embodied each and every one of those things. I was asked to memorialize George, and I think before Shelley even got the question out, I said yes. You know, we as instructors, we truly care for each and every one of you. Excuse me. Our joy is watching you learn and thrive. And sometimes there are students who stand out. George Giacobbe was one of those students. He stood out to faculty and he stood out to his peers and his colleagues. People stand out for different reasons to us, right? Sometimes through their successes and their struggles, which we've all had in this program. Sometimes because they remind us of us as students, right? George stood out for so many reasons. And when I was thinking about talking about him today, I was thinking, what would I want to hear if I were his family, his friends, and his colleagues? What would be important to me to understand and have someone share about him? Most important, I want to say that George had an impact on the people in his life. He made people smile. George really made people smile, and he had an infectious smile of his own. You know, I worked with him, and we all did as an instructor on Zoom, but that smile and that joy of learning came straight through that monitor. And like I said, it was infectious to everyone around him. Well, I don't know him as well as his family and his friends and some of you as his colleagues and students. There were some things about him that were just so very evident. And like I said, came through even on a monitor, okay? He lifted others up and encouraged and supported his fellow students. I remember, you know, because it's on Zoom, our advanced physical exam classes, they had to perform these exams on videos. And I would watch George's and one of his fellow students, and he would be encouraging. We can do this. We got this. All right? Oh, you did a great job. That was awesome. And I think that, you know, that ability to support and encourage, especially when others were doubting themselves, and he knew that that's what they needed. George, I've heard about his career as an RN through preceptors, through colleagues of his at various at the hospital that he worked at, and he was an exceptional nurse. Clinically, he had the heart of the nurse, and I have no doubt, as someone who worked with him as an instructor, that he would have been an exemplary nurse practitioner. George leaned in. And I remember in classes, he was so inquisitive and curious and just, really out there and leaning in. In fact, so much so that, he'd be right in the screen on Zoom. And sometimes he leaned in so much that I would have to say, is there anyone else in class who would like to answer this question, George? Let's give someone else a chance to answer. He made teaching a joy for me, and I want to thank him for that. George is missed, but more so than by his family. The School of Nursing and his fellow students here want to share our deepest sympathy to his family and friends, particularly his family, who I hope is watching this tribute to him and feels the love that was here for him at UCLA and the respect and admiration that was here for him. What I think George would want, as I think any of us would want, is that we remember him in the best way possible, by letting his memory inspire us to lean in, to be curious, inquisitive, stay passionate about our mission to our patients, to lift others up when they're struggling, and to make people smile. Thank you.
Okay, thank you so much, Catherine. And now is the highlight of the day, right? But we waited for the white coat part. So now we will be presenting the white coat to the students, and they will be presented by each nursing specialty. We are to highlight one faculty member from each of these specialties at a time. The first is Dr. Nalo Hamilton from the Family Nurse Practitioner program, Yankee Markham from the Adult Gerontology Primary Care program, Dr. Elizabeth Thomas from the Occupational and Environmental Health subspecialty, Dr. Amy Lohman from the Pediatrics program, and finally Dr. Stacy Green from the Adult Gerontology Acute Care program. Following the video highlights, we will present the white coats to the students in each specialty track, and the faculty member from each specialty track will come on stage, and Dr. Dean Zahn and myself also will assist with the white coats to the students. Students, as you come up to the stage, please hand your name card to the reader before stepping forward to the spot indicated on the floor here. So that will be the spot where you're getting your white coat. Then please hand your coat to the faculty member or Dean Zahn or myself, and we will help you placing the white coat on. The photographer is here to get your photograph, and then you may return to your seat, guided by the student affairs staff. So we will start our white coat ceremony, the highlight parts, with the Family Nurse Practitioner specialty and with Dr. Nalo Hamilton.
A family nurse practitioner is one who is able to provide care to patients across the lifespan, from the tiny little pediatric patient all the way up to the more seasoned patient. Now here at UCLA, we educate Bruin scholars. So yes, I'm able to help you with your research. How do you approach a clinical problem? How do you look at the evidence? And how do you make sure that you are the best clinical scholar and advocate for your patient? Students, we look forward to having you every year. We look forward to seeing you grow and to blossom into that fantastic clinician that we know our program trains you to be. Parents and family, we thank you for lending these students to us. Now we know it won't be easy, and we know that they might be distracted at times because certain activities or assignments are due. But please know, we are here to educate the best Bruin scholar possible. That is not only a clinician, but is also patient and is an advocate for one in their most time of need. So when we see them in the classroom and they see each other as they're eating lunch, or you look at them when they look tired sitting at the home table before dinner, please understand that it's all worth it. Because in the end, UCLA School of Nursing is in the business of educating the best clinician this side of the United States. Have a great day and see you soon.
Mercedes Avila. Katrina Byra. Shiante Jones. Laura Dufour. Nicole Ricardo Felix. Olivia Graza. Alicia Yvette Gusan. Abigail Lena. Alexandria Modueno. Zoe McFall. Sabrina Lai. Tina Vion. Tatiana Yannick.
In my childhood in Seoul, Korea, stethoscope was my childhood toy. Only reason is because my mom received a medical degree during the Korean War and became an OBGYN pediatrician and had a clinic that was attached to my home. So clinic became my playground. I also would look at American soldiers posting and protecting our country as we recover from the Korean War. And I just remember having a dream that with my stethoscope, I'm going to help the man who helped us as my thank you. Well, my dream came true when the United States called for foreign physicians to immigrate. Our family came, and I was able to achieve 2 bachelor's degrees, one in nutrition science and dietetics from UC Davis, and another bachelor's science in nursing. While I was being a nurse practitioner student going to clinicals like you have, I realized that there was more need to pioneer the elderly care more. Therefore, I purposely specialized in gerontology specialty. And for 32 years of practice, it's been a very satisfying journey to see elderly people are now being respected and have more voice. And it's due to the fact that there has been more nurse practitioners who are advocating for vulnerable populations. And with that, it's been my ultimate journey and pleasure to have taught 22 years of nurse practitioners to become the nurse practitioner and AGMP PC program and their specialty, but also having them to move on and be fabulous and admirable nurse practitioners.
I have a special interest in occupational and environmental health. I've been in the specialty since 1985. Occupational health truly is a public health discipline, and you are able to impact people, not just their work, but their home life and the community, and environmental health is part of the discipline as well. I was able to impact people in their work and in their personal health, prevent hospitalizations, and save corporations lots of money on disability, as well as preventing injuries. And after doing that for 20 years, after finishing my master's, I decided I want to get my PhD. And once I got my PhD, it was like this was the opportunity to pay it forward. So teaching is doing that. I love working with students, helping them succeed, and understanding that in every arena, whatever place you're working in, you have the potential to prevent injury and illness, and occupational health is one of the great places that you can do that. Thank you very much, and congratulations to all of you as you get your white coats. I'm very privileged to work with you as students, and I learn something every day from my students.
Lana Han. Upiana Shamaine Santiago. Alexandra Venuto.
I've been teaching for almost 10 years in this specialty, and every single class of students brings me joy. I love watching them begin. It's almost like a small Bambi, and they're just learning to walk in this new role. When they do this, they slowly but surely create competence and confidence in their new clinical skills. And eventually, I have called many of our students over the last 10 years colleagues. I currently work in a small department with 4 nurse practitioners, 2 of which were former students of UCLA School of Nursing. I'm very proud of every single graduate and know that they are getting the very best education from excellent resources, our entire team of faculty, to prepare our students to be the very best nurse practitioners possible. I also graduated from UCLA School of Nursing in 2005 as a pediatric nurse practitioner and pediatric clinical nurse specialist, and went on to receive my Doctor of Nursing Practice. And last year, I finished my pediatric acute care certification and postmasters. The sky's the limit. You guys can do it. You deserve it. You will get it. End of story.
Good afternoon, everybody. I would just like to introduce myself. I'm Dr. Nancy Pike. I'm professor and director of research at the school. I also wear another hat as the coordinator of the pediatric APRN program, and it is my great honor in 2 ways to have worn my advanced practice coat for 28 years in clinical practice, and my honor to introduce our new incoming students. So thank you very much. The first name is Gabriella Canizal. Mavis Ann Fernando. Alexandra Foy. Amy Fung. Yalda Gatter. Victor Leong. And Jessica Schneider. I'd like to also acknowledge our other pediatric faculty here today, Dr. Amy Lohman, who you just heard, and Dr. Christy Westfall.
I actually fell into acute care on accident. I started out as geriatric primary care. On a beautiful accident, found out that I belonged in oncology, and I stayed in acute care for 20 years working with people with high acuity illness, cancer. Acute care nursing is a very specialized area of advanced practice nursing. where you take care of people in their most vulnerable stage of illness when they're acutely ill, either in a specialty clinic or in the hospital or in an ICU. And my favorite part about teaching is watching how you guys grow into that role. And there's nothing better than walking by you in the hall at Reagan or handing you off to a preceptor who I also educated. I want you guys to think about what you want, not about what you're supposed to do. Think about being true to yourself. What do you love to do? You guys have another year. You're almost done with this year. I want you next year to keep your eye on the prize. It's going to get hard. It's going to get intense, but you guys can do it. If I've learned nothing else about you this year, I've learned that you guys can do it.
Hi, everyone, I'm back. And this is the happy part, right? So, I guess, come on. So our first student, Genevieve Areola. Good. Gohar Bagumian. Yasmin Balablat Poblete. Olivia Bargel. Mary Bryan. Annette Latosa Casimiro. Nicole Cataldi. Stelliana Koniak. Rena Doglian. Adriana Melissa Flores. Yeah, in class, Gigi. No, but I'm going to get this. Doratuya Gabrielle. Surinder Gill. Kaylee G. Melissa Jordan. Marika Kazarian. Joyce Kremian. Alexis Gina Kim. Michelle Kim. There we go. Right on. Michelle Larson. Fidesz May McToto. Thank you. I should put that one. Lindsay Marsacek. Michael Ocampo. Patrick Rosano. Very nice. Claudine San Gabriel. Lizelle Tanganen. Miguel Angel Velasquez. Julia A. Villagrana. Nice. Yasmin Vitella. Megan Weddington. Okay. Forgive. Shin Wei. Anaya Whitehead. Whitney Wiedemann. Diana Wong. And Rena Daglian, who we already have, is, we're going to be presenting George's white coat to one of his dear friends in the program, Rena Daglian, and she accepts this in his honor and in his memory.
Okay, so congratulations, students. Now let's hear from the students themselves about what the white cone means for them. So we have a short video to show it to you.
The white coat means a lifelong dedication of duty to care for patients in their vulnerable moments with the utmost compassion, respect, and empathy. It signifies the autonomy and trust that was placed on me to heal their body.
When I wear this coat, I'm deeply indebted to my ancestors and elders who worked so hard for me to be here today. In their bravery and as an integrative practitioner, I look forward to empowering people to actively be involved in their healing process.
This white coat means to me all the hard work and sacrifices my parents have made as immigrants in order to support us with our goals and dreams.
It really signifies grace, confidence, and humility. And to be wearing this white coat is an honor. And it means the world to me to begin this journey to expand my foundation of healing, saving lives, and helping my community.
This white coat ceremony means a transformation from the bedside nurse to a provider. It means my commitment to my community. And lastly, it's my way of conveying to my kids, Juliet and Joshua, that everything in life is possible.
White coat means commitment and dedication to me and providing compassionate care for my patients.
To me, white coat ceremony is a symbol of professionalism and promise that I will provide the best care for my patients.
To me, white coat is symbolic. It is a privilege from Florence Nightingale that has been passed down every year for over 120 years.
The white coat represents my parents, my father who passed away in 2019 and my mother who's still here helping me through life. They taught me to be my best self and that education never stops.
The white coat marks the beginning of a lifelong career to providing safe and quality care as a clinician and to positively impact the health and the lives of my future patients for the better. It also represents a validation to the hard work and the determination of my past and present, and a reminder of the responsibilities that lie ahead. It is a true testament of the hard work and sacrifices that my friends, family, and myself have made to get me where I am today.
So this white coat not only represents the responsibility that I will take on as a competent nurse practitioner, but to always be empathetic and show compassion to my patients. It also represents all the support that I receive from my family and friends to be where I'm here today.
This white coat represents a commitment I made to myself a very long time ago, to never give up even when I felt like I couldn't bear to take another step. A commitment to prove to myself that despite what I've been through, I would not let it prevent me from becoming whoever and whatever I wanted to be.
The white coat ceremony to me is a manifestation of the goals and vision that I've had for the last few years of becoming a family nurse practitioner. So excited to be here at UCLA.
Please say go Bruins. Bruins.
Go Bruins.
Okay, so that was great. We heard from everybody. Even I think I saw a future UCLA nursing student who hopefully will come to us and will be an APRN in the future. So now I would like to welcome Dr. Carol Cunningham to the stage to lead all of the nurses in the room in the International Pledge for Nurses, which can be found printed in your program. Please read the pledge together right after Dr. Cunningham starts.
Thank you, Dr. Lazar. If I can ask all the APRN students to please stand. International Pledge for Nurses. And join me. In full knowledge of the obligations I'm undertaking, I promise to care for the sick with all the skill and understanding I possess, without regard to race, creed, color, politics, status, sparing no effort to conserve life, to alleviate suffering, and to promote health. I will respect at all times the dignity and religious beliefs of the patients under my care, holding in confidence all personal information entrusted to me, and refrain from any action which might endanger life or health. I will endeavor to keep my professional knowledge and skill at the highest level and to give loyal support and cooperation to all members of the health team. I will do my utmost on the National Code of Ethics applied to nursing and to uphold the integrity of the professional nurse.
Okay, so congratulations, students. We are very proud of you, all what you accomplished up to this point, and we're looking forward in the future. You guys will progressing very brightly, and hopefully will be no problem as you go through the different classes. Now, I'd like to ask all the faculty and the students with white coat, please exit to the stairway in the courtyard for a group photograph. And all guests, if you can stay seated for a little bit, so the faculty can leave first and after the students. And we can take that photograph. And after the photograph, we can celebrate outside. Please enjoy the refreshment outside the courtyard. Thank you so much for coming.